Australia's health regulator says it will expand its crackdown on cosmetic surgery to include botox and other injectables. The Australian Health Practitioner Regulation Agency says there'll be strict new advertising guidelines, especially around the use of social media and influencers, as well as a ban on testimonials. Well, let's get more now on that story with National Health reporter Alison Branley, who joins me now in the studio. Alison, what has the regulator announced?
So for the past 12 months, they've been looking at cosmetic surgery, but now they're going to expand their scope to include non-surgical treatments. So that's injectables, things people would know would be botox, dermal fillers, something called a thread lift, and fat dissolving injections, all sorts of some weird and wacky ones really of things people can have for cosmetic enhancement.
And so what exactly have they found?
So in the past 12 months, they've had a cosmetic surgery hotline, and they've had more than 400 calls from patients and doctors with concerns about dodgy operators. That translated into about 200 or just under official complaints, and the regulator then went after about 26 doctors and either put restrictions on their licence to practice or banned them from doing cosmetic procedures altogether.
And what's been the response from patient groups?
So patient groups are really welcoming this crackdown. They say it's long overdue, but what they really want to see is this kind of crackdown being ongoing. They're saying they're still seeing doctors breaching advertising rules, especially on social media, overselling the benefits, underplaying the risks, if at all, and really not making it clear this is a medical procedure and can have catastrophic complications. It's the sort of thing, just this morning a plastic surgery surgeon said to me, when these things go wrong, they go catastrophically wrong.
Yeah, that's really interesting. I thought in Australia that it is not legal to advertise these sort of procedures on social media. So why is the regulator now cracking down on that?
Well, it's the sort of thing that's just been going under the radar for a long time. As we know, social media, it's so broad and it's really hard. It's kind of a whack-a-mole situation. And the regulator actually said to me they've now had to develop their own cosmetic unit just to keep up with the developments, just to be able to crack down on all the different things that keep happening. And one of the clear things that came through is despite all the publicity, there are still doctors and other health practitioners, dentists, nurses, who are breaching these advertising rules on social media, even though in other medical spheres it's just not allowed.
So what are the warnings to patients?
The warnings to patients are really check the credentials of the person doing this, ask them about their training, check out their clinic, but also wait. Sometimes these decisions are spur of the moment. Make sure it's something you really want to do.
Okay, Alison Branley, thanks so much for being with us.